Hello everyone, I am Dr. Parul Singh and I am Associate Professor in GSVA Medical College, Kanpur. I am a specialist of oculoplasty and pediatric ophthalmology. So today I would like to give my views on the disease which is called Tosis, which is generally called drooping of lids. So Tosis is a condition in which the upper eyelid falls down. So we call it drooping. Now, ptosis can be various types. Most commonly, it is seen in children, which is in which we call it as a congenital ptosis, which means children are born with drooping of lids. It can be found in adults also. Due to various reasons, various diseases are associated, most commonly myasthenia gravis, and sometimes it is senile, so we call it aponeurotic ptosis. So little information about the congenital ptosis. So when a child is born with drooping of lids, it can be of various grades, like it can be mild, it can be moderate, it can be severe. So the first problem is a cosmetic problem because your eyelid are drooping. So it can be one eye, which is unilateral, or it can be bilateral, which means both eyes are drooping. So the foremost thing is that it is a cosmetic problem. It will bring a lot of deficiency of self-esteem in children or even in adults. And second, the major problem is when it is severe ptosis, it causes amblyopia, because when the lid is drooping, so the light will not fall on the eye and it will not form an image on the retina, so it will cause amblyopia because of stimulus deprivation. So these children, for the most important reason to correct ptosis is to avoid amblyopia, and second, of course, is to correct for the cosmetic purposes. So ptosis is basically treated by surgery. So we have to deal depending upon, we see various parameters on the muscle strength, which is the basic muscle involved in causing ptosis is LPS muscle, which is levator palpebrae superioris. So we correct depending upon the strength of the muscle. There are various surgeries which we do. So basically it is a surgically corrective disease. Secondly, it is found in adults and various diseases, most commonly myasthenia gravis, which we have to rule out. It can be traumatic as well because of some trauma. There is disinsertion or some laceration in the LPS, levator palpebrae superioris muscle. More commonly, it is senile ptosis, which is aponeurotic ptosis, in which the aponeurosis of the muscle gets weakened or disinserted. So these patients also have to be dealt with surgery. So most commonly there are few types of surgeries. One is levator resection, one is sling, in which we do a frontalis suspension. So we see for different types and severity, we have to decide accordingly. So this is something about ptosis.